thank you. So my name is Hanna. I'm from Addis Continental Institute of Public Health, which is a research institute based in Ethiopia, and I will be presenting preliminary results from a study from Addis. And it's entitled Food Environment Around Schools and Adolescent Consumption of Unhealthy Food. So as a background, you all know that early adolescence is a critical life stage for growth, and it is a period where dietary habits and preferences are formed. And most of these children in early adolescence spend most of their time at school, making school a potentially ideal platform for interventions that target adolescents. Additionally, in low-income countries like ours, school is also considered as a gateway for commercialized and processed foods. In line with this, we have seen that research are coming out indicating that one of the drivers for unhealthy food consumption include availability of large number of vendors around school. With this, we had our objective set in line with that, and one of the main objectives of the study was to determine whether the number of vendors around school was associated with consumption of unhealthy food, and to explore other influencers for adolescent consumption unhealthy food in schools. For this study, we used a mixed method approach. We had 10 subcities in Addis Ababa during the time of the survey. So we included all, and we sampled 2 government schools from each subcities. And from each of the schools, we had randomly selected 60 students within the grades 5 to 8. We had a total sample size of 1,200 adolescents. In addition to the adolescent surveys, we also had vendor assessments around schools in 1 school per subcity, meaning 10 out of the 20 schools were sampled for this vendor assessment. And we had captured 343 vendors. The final stage was to have a focus group discussion with adolescents in 4 randomly selected schools. Then we had the analysis, and the main outcome variable for our study was consumption of unhealthy food. And the unhealthy food we selected for this study was fried foods, sweets, and sugar sweetened beverages. And consumption was defined as consuming any of these foods at least once a week. And the main exposure for this study was a number of vendors selling packed foods, snacks, deep fried foods available around school. And the number of vendors we dichotomized later on using mean as a cutoff. And the confounders we have considered for doing our models were household wealth, adolescent age, sex, parental education, and household hunger. And we used mixed effect logistic regression models to construct our final models. So just to give you the sex distribution, there were slightly more female, for 55% were female and the rest were male. And when we look at their parental education, we can see that nearly 50% of the fathers did not complete primary school or had no education. Similar for when we look at the mother's education, we can see that 70% of the mothers did not have any education or have not completed primary school. When we look at the vendor description, we can see that nearly all of the vendors were located outside of the school premises, 94%. And when we look at the type of vendors, souks or kiosk were the most common type. And finally, when we look at the type of food items sold within the different vendors, we can see that snacks and beverages are sold in the majority, with nearly 7 out of the 10 vendors around school selling snacks and beverages. When we look at consumption, we tried to see consumption of sweets and sugar-sweetened beverage separate from fried foods. And we see that 45% have not consumed any fried food within the past week. While when we look at consumption of sweets and sugar-sweetened beverage, we see that only 21% did not consume sweets and sugar-sweetened beverages in the past week. So the results of our study show that nearly 80% of primary school students within the age group 10 to 14 years consume sweets and sugar-sweetened beverages, and it was considerably higher than what we had anticipated. The other thing we tried to see was whether consumption of these three food items, selected food items, was associated with the number of vendors selling those products. And contrary to what we had anticipated, they were not associated. So let's see if I can get my pointer to work. So what we tried to see is school food environments having less than 3 vendors selling deep fried foods and greater than 4 deep fried foods, vendors selling deep fried food. And we tried to see the association between consumption in an adjusted model and after adjusting for adolescent age and sex in the second model. And in the last and fully adjusted model, we see the association after adjusting for age, sex, household wealth, household hunger, and post-parental education. And we can see that in all three models, and when looking at consumption in all three types of food, the number of vendors was not associated with consumption. So the next question that instigated was, if not the number of vendors around school, what else influenced adolescent consumption of unhealthy food? And from the focus group discussions with the adolescent, they mentioned that we are concerned about food safety, and they were worried about the safety of both street foods and packed foods. And as you can see in the first quote with packed foods, their worry was in relation to expiry dates. And as you can see in the second quote, with street foods, their worry was more with the hygiene practice and cleanliness of the food. But again, when you see the second quote, some of the adolescents seem to be thinking it is packed foods were relatively safer than the street foods. And this could potentially be the reason why 80% of them were consuming more packed foods in the form of sweets and sugar-sweetened beverages. The other thing we have seen is, again, from the focus group discussions, the participants repeatedly use the words, if I get some money, when I get some money, that they would opt for cheaper and sweeter things. Therefore, we can see that financial access limits consumption rather than choice. Of course, this study was conducted in government school students, and our results possibly could be different if we did the study in private school students who have better access to financial resources. Having said this, from our preliminary analysis, we can conclude that majority of the students or adolescents in our study reported consuming deep fried foods, sweets, and sugar-sweetened beverages at least once a week. And one thing that is clearly evident here is there is a need for further research using more detailed data collection approach in order to design appropriate and context-specific school-based interventions. So I think with this, I will finish my presentation. Thank you for your time.